And welcome back. Do you have knee injury or maybe knee pain? Well, there's a new study that you might be interested in. Dr. Brad Tolan with the San Antonio Orthopedic Group is here with us this morning. Doctor, how are you doing today?
Good. Very
All
good,
right,
thanks.
so knee pain, a lot of folks have it, some knee problems, but what is articular cartilage damage? What is that?
Well, there's two types of cartilage in your knee. One, the meniscus cartilage, which you hear when people say I tore cartilage in my knee, they're usually referring to the meniscus. The other type of cartilage is what's called articular cartilage, and that's what covers the ends of the bones. And that's when people start developing arthritic type symptoms or arthritis, it's the articular cartilage that's involved.
Ah, okay, so how exactly is the NeoCart? How is that different?
Well, the traditional treatment for these type of cartilage defects, think of it as like a pothole in the bone, on the cartilage.
Okay, let's see if we take the shot here. Okay, so yeah, go ahead and point to it, doctor.
So this is a cartilage defect.
Okay.
So again, think of it like a pothole that's on the surface of the joint.
I've got to ask you, how does a pothole like that, how does it develop?
Sometimes just a traumatic injury when you're younger. It can take sometimes even years to develop and become symptomatic from it.
Now, you wouldn't get something like that from running, would you?
You can from repetitive activities over and over again, can cause little micro cracks in the cartilage that eventually deteriorate and turn into sort of what we consider a defect.
Okay, and so you have got a current study, and who's eligible for this study?
Well, we're looking for patients between the ages of 18 and 59. The ages have just recently expanded on the upper end. It used to be 55. And we're looking for patients that have these type of lesions in their knee that are symptomatic.
Okay. And the thing that makes the NeoCart different is it uses your own...
It uses your own cells. So the traditional treatment for these type of defects has been something called a microfracture. And what a microfracture is, you actually poke little holes through the bone and it bleeds and it forms like a little scab over that area.
Hey, is there any way we can come back to the chart here?
Yes.
So how does this exactly work?
So the microfracture part is by poking holes in the bone, it bleeds and forms a scab and turns into cartilage. But that cartilage is not the normal cartilage that's in our joint. It's a repair type of cartilage.
Thin too, right?
It can vary in terms of the thickness, but it's not durable. So we know that usually over a short period of time they can deteriorate. So the NeoCart is actually taking your own cells and growing it and putting them on a membrane and coming back and putting this membrane with your cells over it to create a more normal cartilage and hopefully avoid the problems that we see, which is mainly arthritic type of problems.
And if you don't do this type, what is the other way to solve an injury like this? The most typical way?
The most typical way is the microfracture that I referred to before. If it's a full thickness defect, meaning it's the thickness of the cartilage all the way down to the bone. There are people that have little smaller defects that typically may not even be symptomatic. It's really these larger ones that tend to be symptomatic and are at risk for developing arthritis down the line. So the goal is to restore your normal cartilage, hopefully prevent arthritis, and typically in patients that have bad arthritis, sometimes you end up doing a knee replacement, which is an artificial knee. So the hope is this alleviates that or slows down that process significantly.
So your hope is to keep your knees the way they are now, keep them going for longer before you have to go and have a total knee replacement.
Exactly.
And hopefully, maybe you'll never get there.
Hopefully. I mean, that's what I always tell patients, you're better off with your own knees. You want to keep going as long as you can.
All right. Well, thank you, doctor. And if you want to know more information for this NeoCart trial, learn more information, what you want to do is you want to text KNEE, that's KNEE 9 to 87888, or you can just give them a call, 830-477-0607, or you can go to neocartimplant.com. So, doctor, fascinating information.